Just a few quick recap pieces. I think it was a really great note to end on, Cindy, because at the end of the day, while we are focused on Medicaid, I think the goal and what we've achieved is the recognition that this conversation isn't about DHHS and the Medicaid program, that the changes to Medicaid are far-reaching, and that the folks in this room, there are implications for just about everyone. And that was the goal, I think. The goal was to sort of set that frame, not to solve the questions, because we certainly can't, but to at least figure out what some of them were, and I think we did a good job of that. So thank you all for that. You know, I think anytime you leave with more questions than you started with, that's a good day, even if it makes your head hurt. So I assume that other people's head hurts. But we will continue to talk about these things. Just a few quick things. Again, just want to thank our sponsors, the Endowment for Health, WellSense, New Hampshire Healthy Families. We also got support from Minuteman Health and Harvard Pilgrim Healthcare. I should also note that in addition to sponsoring the day, many folks from those organizations provided input into the sessions through advisory meetings and those sorts of things. So the content as well as the actual logistics were supported by those folks. You know, I think what we know is that this is not the end of the conversation. This is the beginning of a conversation. How the conversation continues, I think we still need to figure those parts out. What I would ask is two things related to that. One is there is an evaluation form in your folder. Please fill it out and give us feedback. Included in that feedback, let us know if there are other topics, suggestions for topics that we should either convene around or maybe write papers about or try to convene smaller groups, what have you. But if you have ideas for the ways that you think this conversation needs to continue, we would love to have that in your evaluation forms. As we had said a few times, those questions that you jotted down over the course of the day, if you didn't get them answered, please let us know, drop them off when you drop the evaluations off so we can collect them and figure out, again, where the open questions are in our stakeholder community and find out if there's a way we can facilitate more convening around that. Wanted to thank, again, our panelists, so I think most of them stuck around. I think there's a big statement about the value of a day when this many people stay right to the end, so we appreciate that. So I want to thank the panelists and the speakers. And one last time, just because it's really important to do, the team that brought this together, despite the accolades being mostly for Lucy and I, was not Lucy and I. It was Allison Rataj, Bridget Drake, Suzanne Shumway, Megan Shields, Meredith Feenstra, who are all sitting outside still waiting to help you with anything remaining. Ashley Peters, who's in the room, Kate Crary, and then we had a host of folks who were just willing and ready to be at the end of the day, Molly, Matt, Holly, and Kate. So again, thank you all for your participation in the day. Please stay informed about what we're doing through our website, and we want to stay informed with everything that you're doing. So please, as things are come out, as you do research, as you identify issues, let's just stay connected and we'll continue the conversation however we think is best. So thank you. 4 minutes over. Not bad. 4 minutes over.